Hi, good evening to all of the participants. This is Dr. Nandini Gokulchandran. We are going to start the webinar on recent advances in neurological disorders, especially focused on autism, cerebral palsy, intellectual disability. Dr. Sharma will be joining shortly. I am Dr. Sharma's colleague. I'm the Deputy Director of NeuroGen Brain and Spine Institute. As we all know that incurable neurological disorders so far have not for a long time had any definitive solution, and now with the holistic approach of cellular therapy or regenerative medicine, commonly known as stem cell therapy, along with neurorehabilitation, and now the newer science of integrative therapies of oxygen therapy together is giving wonderful results, boosts up the brain repair process and what we scientifically call as plasticity of the brain. Let us see a film which many of you must have already seen, a film of a young boy of 11 years old and how he achieved his full potential with the help of stem cell therapy along with rehabilitation. This may be something which you have seen of, but it is something we like to start a webinar with on a positive note, and a positive note of a difficult situation being overcome not only by the child but the family, because these different conditions affect the family as well. So together how they achieved success, and on that note we will start the webinar. So let's first have a look at Ganesh and his family from US, and how stem cell therapy helped Ganesh improve and become the best that he could, and his maximum potential. Enjoy this film, and at the end of the film, we will start the actual webinar.
He was screaming, he was crying, I was trying to hold him, and we were like 45, 50 people on that bus. And it was 2.5 hours drive each way on the excursion. So on the way back, this woman just let it go. Would you shut up? I felt like a bullet went through me. I just thought, wow. I was like, oh, and I just said, my son's autistic, he can't help it. He really can't help it. And then you could hear a pin drop. Ganesh was born in December of 2003. We were so excited about his birth, and we had lots of family there and friends there. It was just delightful. He was very responsive, very happy baby.
We knew he was extremely spoiled. He always wanted to have his way. He was the apple of their eye. About 1.5 years old. He was a fluent reader. He knew the alphabet and he knew the sound. There were some things about him that were kind of extraordinary.
He was sitting on the kitchen floor, and I was doing dishes in the kitchen, and I just kept saying to him, Ganesh. I kept calling his name, and he would not look at me, and which was very different for him. I couldn't get him to engage with me. I couldn't get him to give me eye contact. And we noticed over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He'd look like that. His speech was not very fluent. So he would say, cheese. He'd get the last part of it right, But not the whole part of it. He had problems with his speech.
He wouldn't even allow us to put the food in his mouth, and he would just be screaming and get away from me and stop hurting me. We were just chasing him with food constantly. We would get some of the other kids and we would corner Ganesh and we would force feed him. And it would be painful to do, kind of cruel as a parent, but we knew that if we didn't have him eat something, then he would have just this huge tantrum, and we all would be just.
When he was 5, he was in school and his teacher asked him to do something and he didn't want to do it, and he had to have his way and the teacher wouldn't let him, so he ran across the room and kicked her. And that's when she called and said she couldn't take care of him, that there was something wrong, to get him checked.
Child psychologists insisted that Ganesh was not autistic. I suspected they didn't have a real accurate assessment of him. And I remember that doctor saying, "Oh, no, you don't have to hire a speech therapist." And I said, yes. I feel like I need to. He's lost so much vocabulary and I don't understand why. So when she came in, I did not know her. She didn't know any of us. And the first 15 minutes, her eyes were just big, and she kept watching Ganesh, and she kept asking me, well, how long's he been doing this, and how long's he been doing that? And Ganesh was getting up every 2 seconds and running around and not wanting to do what she had asked him to do and not wanting to engage at all. The speech therapist said, you have to know your child is autistic. I closed my eyes and I just felt like a million bricks falling on my head. I just felt like that was the worst thing she could have said. Everything that she had said was exactly the behaviors that we had been seeing, but we were just dismissing. We didn't want to see, we didn't want to, I guess, to think of our son as being, autistic.
I did a lot of research, did a lot of studying on the internet and books, and there's no treatment, as we know, and we have to figure out a way to help him out. We tried homeopathy, and I tried it for about 3 months and I couldn't tell a difference.
We got him started on all kinds of supplements. We kept him on a gluten-free, casein-free diet, occupational therapy, speech therapy. I started art therapy with him. We did music therapy with him.
All of that seemed to help some. It seemed to calm him down some, but it wasn't making the problem go away. And the problem was he could not attend to things. He didn't have eye contact. He didn't have attention span.
We were just so frustrated because he didn't seem to be making progress.
Did some research and found out about stem cells being done in Mexico and Panama. I wasn't too keen on doing it because they take cord blood from a newborn and inject it IV into your child, and you don't know what you might be getting into.
We hadn't read too much about stem cell treatment. This was another one of those therapies that someone had sold us on. It was a lot of work, and perhaps we would be let down again. So I was really worried about that.
And that's when I found out about NeuroGen. And I spoke to Dr. Sharma. There was sometime in April of 2015. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
They were so polite and so kind and gave us lots of information. So we decided to try it.
Ganesh had some hesitation about coming to India and going to a hospital in India. The hospital is entirely built to American standards.
Our experience was positive. We were treated like family. We were treated so beautifully. Everyone was looking out for Ganesh. He would wander off, or he would do something quirky, and they were accepting, they were loving, they were embracing him for who he was.
The first stem cell treatment was December 2015.
I think as a mother, when you hand your child over, you have to trust someone with your child. Hand them over for the stem cell treatment that morning, that real concern, that real worry, am I doing the right thing? The time that the procedure started to the time that it was over, things were okay, the way it was supposed to go. And it was just like so comforting. The neuropathologist came to the room. She had done the stem cell count. She said, I want you to know it was great. She said that the count was superb. And she said, everything went without a flaw.
Procedure itself was painless. The recovery was simple, straightforward. We didn't have any problems.
What's really neat about the NeuroGen is that they really put very necessary emphasis on therapies that you have to have in place.
You want to do stem cell, but you also want to do occupation therapy, physical therapy, speech therapy, behavior therapy to get the child back into the mainstream.
We started seeing better eye contact, definitely a difference in his engagement with us, with his siblings. Teachers were commenting, while we can tell a little bit of a difference in Ganesh and what's new, and do you think this is the stem cell treatment? And we were like, that's the only thing we can attribute it to. And then things just gradually seemed to improve overall. His mood, he was so much calmer. There weren't these horrible, horrific tantrums. They were decreasing. And when he would have a tantrum, I could talk him out of it. We could engage with him and we could problem solve. He was able to sit at the table with us. He was trying new and different foods, put the food in his own mouth and do it consistently. As a parent, it's very exciting. He loves popcorn. He really enjoys to make it himself now, which is new. It's a big thing for him. Of course, we're delighted for him.
Very nice. I like how you did that.
Now he's all about taking his own shower. I have to just prompt him to get out. But he'll wash himself and he'll put his clothes on. It's very exciting. Because of his sensory issues, he could never wear anything besides shorts and a short sleeve t-shirt. So now he's able to wear long pants, which is cool. And he's gone from only wearing Crocs to now he'll wear tennis shoes. It was always a joke that he'd go outside and he'd just take all his clothes off. It wouldn't matter who was in the house, who wasn't in the house. It wouldn't matter who was outside. But now it's not the case. Can you speak some languages?
Yeah, different languages. And
Like? Tell them.
like Hindi, Tamil, Arabic.
How do you say hello, good morning in Spanish?
Hola, ¿cómo estás?
It was refreshing. It was exciting. We were seeing new and different things all the time. So it's almost like that window of opportunity reopened for Ganesh. And Ganesh has gone from the third grade 4th month reading level to a 7th grade 1st month reading level in 5 months.
This is the first time since his stem cell that he has gone to a regular school.
After ABS last year, I started going to green, and then I will do a good job in green.
It was as smooth as silk. He started day 1. He followed his schedule with help from a teacher. He learned his schedule from the first day. For his first report card, it was all A's. He's doing all the work. He's pleasant. He's correcting his errors. He's learning from the mistakes, like on the reviews, and getting the answers on the test questions with like 90% accuracy, which is amazing. He would get off the bus by himself. He did not want me to come down and meet him. He walked 2 blocks home and he would come inside the house.
I like to ride the bus home and ride the bus back. I don't want to ride to school.
These things seem minuscule to some people, but to us, it was a huge victory.
Every time he goes someplace, to his grandparents, to school, to wherever, people say, oh, he's a different child now. He's a lot calmer. He's talking normally. He looks like he's grown up.
So he was taking a musical class. He was playing 4 instruments with a group. And then they had a recital. It was amazing. We chose to come back to NeuroGen for the 6-month follow-up. We saw the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. So my husband's board certified in nuclear medicine. So as soon as he saw the images, he knew, and he said, come here, you have to see this. That moment will always be, a memorable moment, because we had that validation, like this was worth it. I would thank NeuroGen a lot for their service, for them persevering, because it is new. It's a new opportunity, and because the research is building. But I appreciate that they are so driven and they're so ambitious for these individuals. They seem so dedicated to that patient. Dr. Sharma had mentioned once, he said, I've asked my staff to treat everyone as if they're my family. And I feel like that is truly what they've done. People think back in America, how could medicine be as good or better in India? When you're here, when you understand, when you're around and when you read and when you know, I've really grown to know and appreciate the caliber of medicine here is by far, it's loving. Here, they're more private, perhaps, they're more individualized. We don't have those options there.
NeuroGen is awesome. The staff's awesome. Dr. Sharma is awesome. Dr. Nandini, everybody's awesome. We love NeuroGen.
I want to thank NeuroGen for giving me the last stem cell. Thank you.
Words of wisdom for parents who have a child that has been diagnosed as being on the spectrum is very simple, very straightforward. Get evaluated for stem cell therapy. This offers the potential for a cure. There's not anything out there that comes even close. I have seen a dramatic improvement both clinically and on the PET CT on my child, and it's unmistakable. It has been a game changer.
I remember one time coming.
So good evening to all the participants. Good evening. Thank you for joining this webinar. just a minute, we are having some technical issues here. All right, so we can start the presentation. So today we are going to look at what is new in the treatment of autism, cerebral palsy, and certain other neurodevelopmental disorders. And for many of you, today is a day that you'll never really forget, because for the first time, ever since you may have discovered that your child has this neurodevelopmental disorder, for the first time today, you're actually going to see hope. So, all right, I'm sorry for the technical problems. Yeah. So I'm Dr. Alok Sharma. I'm a neurosurgeon with a special interest in regenerative medicine or cellular therapy. I'm director of the NeuroGen Brain and Spine Institute, institute that I've founded. And I'm also professor and head of department at the medical college, which is the Lokmanya Tilak Municipal Medical College. So why are we all here today? We're all here because all of you in the audience have these lovely special needs children, and you're trying to do what every parent does, to give your children the best possible chance at leading a normal life. But what has happened so far? You've gone to doctors and you've been told that there's no cure for autism, cerebral palsy, intellectual disability, and you've been told that there is no surgery that can help. You've been told that there is only rehabilitation and that there is no medicine. And of course, as parents, you wonder. I mean, we are sending people to the moon and to Mars, and we have so much science and technology and development. So why can't my child be helped? And I'm here today to tell you that what you're seeing on the screen, that there is no cure, no medicines, no surgery. While this may have been true for the past 100 years, it's no more true today. So, I show you this on the left-hand side. You see a fracture, of the legs. These are two bones of the legs that are fractured. And I ask you, if we or if our child had a fracture of the leg like this, would we give our child physiotherapy or rehabilitation on a broken leg? We would not, right? What we would do is we would get it fixed. We would go to an orthopedic surgeon, he would put plates and screws, and then we would give rehabilitation on a bone that is repaired. But we are not doing this with our children with special needs. So this is a PET CT scan, a brain scan of a child with autism, and the blue area here you see is the damaged area, the weak area, the inactive area, and we are giving rehabilitation on this. Now, what if we could repair the brain? You can see here the green, the brain has started functioning again. You can see blue, which has changed to green. What if we had a repaired brain and we did rehabilitation on that? Would we or would we not get better results? All right. And what I'm here to tell you is that this is possible today. This is no more science fiction. This is real. And we have treated thousands of children where we've actually repaired the brain damage. And once we've repaired the brain damage, we are able to give our children close to a normal life. So what is new is that earlier we only had rehabilitation, but now we've got two additions: cellular therapy using stem cells and integrative therapy using certain oxygen-based treatments. And this combination of cell therapy, which repairs the brain biologically, of oxygen-based integrative therapies, which help in the healing of the overall brain, and rehabilitation, which then teaches the brain what to do. With this combination, it is possible to reverse autism. Yes, you heard me correctly. It is possible to reverse autism. So the old thinking was that once the brain or the central nervous system is damaged, nothing can be done about it, that it is not capable of regeneration. This was the thinking for the last over 100, 150 years. The new thinking is that some regeneration is possible by cellular replacement and repair. So now we have a new thinking. And how do we do cellular replacement and repair? we use something called cell therapy. And that's why I like to call it an idea whose time has come. And what cell therapy does, it shifts us from a state of hopelessness to one of hope. The word stem comes from the stem of a tree or a plant. And just like from the seed, the first thing to come out is a stem. And that from that you have branches and leaves and flowers and fruits. There are some cells of the body which can become any cell. So like the words, like the stem gives rise to branches, leaves, fruits, etc. There are some cells which can become any cell of the body. It can become a brain or a muscle or a heart or a blood cell. So a cell which can become any cell of the body, that is a stem cell. Now these cells, they have the ability to repair, to replace, and to regenerate. So once there is any damage in the brain or anywhere else, if you could repair it, if you could replace it, and if you could regenerate it, you'd be able to get a brain which is close to normal. So the stem cells are of two types. You have autologous, that means we take from the patient, from the child, and put it back into the child, or allogenic, where you take from somebody else and put it in the child. So there are two types, autologous and allogenic. And, what I'd like to show you is a very short movie clip of Professor Stephen Hawking, who was considered to be one of the greatest scientists ever, along with Einstein and Newton. And he suffered from a disease called motor neuron disease. He died a couple of years ago, but this is what he had to say about. So how do stem cells work? The first property of stem cells is that they multiply. So if you have a single stem cell, you can make millions of stem cells out of a single stem cell. Second, and the most important property of stem cell is that the same stem cell, you can make this into a brain cell or a muscle cell or a heart cell or a fat cell. So the stem cell can be made into any tissue of the body. So these are two amazing properties, the ability to multiply and the ability to convert into any tissue type. And this is what gives stem cells the amazing power. This is a picture from our own research. This is not from the internet. This is what a stem cell looks like, okay, in the beginning. And at the end of 6 weeks, we see that it converts into these are neurons or brain cells. So we first proved, and this was work we did almost 15 years ago, that stem cells can convert into brain cells and that they communicate and connect with each other. This is our own basic research, which we did for 10 years before we started treating patients. Stem cells also release certain positive chemicals in the body called growth factors, and this has a tremendous healing effect. And they also improve the blood supply to the damaged part. So these four properties, the ability to multiply, the ability to become any cell type, for us, we want them to become brain cells, the ability to release positive chemicals, and the ability to improve blood supply. This repairs the damage. So, I just mentioned this lightly. In 1990, when I was a medical student, if I wanted to do work on a computer, type something, I needed a computer. For calculation, I needed a calculator. To take a picture, I needed a camera. To make a video film, I needed a video camera. If I wanted to see the direction, I needed a compass. To listen to music, I listened to it on a Walkman. I watched TV on a television set. For an alarm, I needed an alarm. For books, I needed books. To make a telephone call, I needed this kind of telephone. And if I wanted a torch, I needed this. And now, as you can well guess, all of this is now available in your pocket, in your hand. Okay, your mobile phone today does what 30 years ago you needed so many things for. Exactly like this. Stem cells are cells which do things that otherwise you needed multiple things. So it modulates the immune system, it improves the blood supply, it prevents cellular death. Okay, it has an antioxidative effect, it causes cell migration, cell stimulation, and so much more. So just like the mobile phone, does, like 50 things that you required other things to do, stem cells have exactly that kind of role. So basically, stem cells, what we do, we take healthy cells to replace damaged cells. So if this, on the left-hand side, the blue area is the damage in a brain of a child with autism, you give stem cells and the damage goes away. So stem cells are of different types. You can get stem cells from the embryo. This is from the, from aborted tissue or from spare embryos of test tube babies. These are from the embryo. So life starts when the father's sperm and the mother's egg comes together. And on the 5th day of life, it forms something called a blastocyst. This is a bundle of embryonic stem cells. So all of us on our 5th day of life, we were a grape-like bundle of stem cells. And from those embryonic stem cells, the whole body was formed. So our entire body was formed from a bundle of stem cells. All right, so obviously it means that those stem cells became our brain, our bone, our heart, our lung, our kidneys. So stem cells are derived from this, but this is a little controversial use of embryonic stem cells. There are ethical issues. So we do not use embryonic stem cells. I wish to state again, we do not use embryonic stem cells. You can also get stem cells from the umbilical cord. So the umbilical cord is the cord that connects the mother and baby at birth. And this has got stem cells. Nowadays, parents at birth, earlier the umbilical cord was thrown away. Nowadays, parents actually preserve it. And if it is preserved, then it could possibly be used. If it is not preserved, there are some companies that go and collect umbilical cord from nursing homes and hospitals, because this is earlier just thrown away in the garbage. So companies collect it and they make stem cells. So these are packaged sort of stem cells. Now, we don't use this either. The reason why we don't use this is because these stem cells have preservatives. See, anything which is preserved has to have a preservative. And the preservative for stem cells is something called DMSO, which is actually toxic and dangerous to the brain. Also, you cannot put this directly into the brain or the CSF, the fluid which we put it into. So we do not believe that umbilical stem cells are as important, are as powerful, although there are many people, in centers overseas, in America and close by, that are using this. But we don't believe in it, and I'm going to show you why. What we do is use adult stem cells. All right. So adult stem cells occur in children as well, and you can get them. So in our bone and in our fat tissue, inside our bone in particular, there is a liquid called bone marrow, which has got millions of stem cells. And we believe in this, as I'll show you. The reason why, because you can get millions of fresh, very good stem cells from the bone, and it's very easy to get. You just put a needle and you can get as many cells as you want, as much bone marrow as you want. So it's very easy. So we use this. So whatever I will talk about now will be about autologous adult stem cells. We do not use embryonic, we do not use umbilical cord. And the last type is something called induced pluripotent stem cells. So these are stem cells where the outside is adult and the inside is embryonic. This is still in the research stage, and so this is not available right now for clinical practice. So we work with adult stem cells because they're 100% safe. In fact, they have been used for many years. They've been used for 50, 60 years for blood disorders. They never form tumors. Embryonic stem cells have that risk. They never get rejected because they are from your own body. You can easily get them from a needle prick. You don't have to do any surgery, just a needle, and you get as much as you want. And there are no ethical issues or problems with use of adult stem cells. So that's why we use it. And we inject it intrathecally, and I'll explain all that in some time. We inject it into the spinal fluid, because the spinal fluid then takes it directly to the brain. So the reason we choose this is because this can be done through a simple needle. You inject it and then it goes all the way up. So we prefer to use this because it's minimally invasive, it's safe, you're putting it directly where it is required, and it doesn't get diluted in other organs. So you're putting it right where it is needed. So what's the scientific base for stem cell therapy? You all are aware that the highest recognition in medicine is something called the Nobel Prize. And 3 times 3 times in a 15-year period from 1990 to 2012. The Nobel Prize went to stem cell work. And the work that we do, demonstrate stem cells from bone marrow, this actually got the Nobel Prize in 1990. What is the scientific base of the work that we do? Because I am saying something quite audacious. I'm saying that autism can be reversed. So what's the scientific base that a doctor like me, what is the base on which I can make that claim? I base it on my own scientific publications. So we have, well over 100 papers, scientific papers, 16 of which are on autism, 15 on cerebral palsy, 4 on intellectual disability. So what is the importance of this? The importance of what is the paper? So a paper is something which is published in a medical journal. This is not a magazine. This is a medical journal. And medical journal have very strict rules about what should be published. So when you send something, the editor and the editorial board, they review it. Then they send it to 3 independent people across the world who study that data. And your data is validated, it is authenticated, its scientific basis, ethical content is approved. Only then it is published, because the journal's name is also at stake if the journal publishes something wrong. So we don't have 1 or 2, we have over 100 scientific papers. This is called peer review. Peer review means somebody outside of me, somebody outside of my hospital, independent people from across the world have studied each of my over 100 papers, and they have shown that this is worthy of publication because it's authenticated. So whenever you go to any doctor for some new treatment like stem cell therapy, you must ask your doctor whether the results of their work are published in scientific papers. Because if it is published in scientific papers, then it is peer reviewed and you can say that that work is authentic. We also have, in medicine, we have what are called medical textbooks from which medical students and doctors, they learn. So in medical textbooks now, so this is a book on recent advances in autism. And in this, they have introduced the chapter, Stem Cell Therapy in Autism, and they asked us to write this paper. So when international authors, when they're writing books and when they want to write a chapter on stem cell therapy, well, they ask us to write it. This was published in 2017. Here is another book on cerebral palsy, challenges for the future. This is a European textbook published by Intech. Here again, the chapter on stem cell therapy for cerebral palsy has been written by us. In this book on physical disabilities, therapeutic interventions, the chapter Stem Cell for Pediatric Neurological Disabilities, again, this chapter is written by us. In this book on muscular dystrophy, again, the chapter Stem Cell Therapy for Muscular Dystrophy is written by us. This is published by Avid Science. So as you can see, international medical textbooks are not only introducing chapters on stem cell therapy, but when they want to decide who will write it, they actually approach us because we have the world's largest experience, clinical experience, and also because we have the largest number of publications in scientific papers. So in India, at the highest level, there is support for stem cells. Our Honorable Prime Minister, Sri Narendra Modi ji, when he visited Japan, he actually took time out to visit the Stem Cell Institute of Professor Yamanaka, who won the Nobel Prize for stem cell research. It's not often that prime ministers, when they travel abroad, take time out to visit a stem cell facility. Here you can see the Honorable Prime Minister, when he went to Bangalore, he visited the Institute for Stem Cell Research. He actually, from his schedule, takes time out to visit stem cell facilities. And, I was very fortunate that in a book that I have written, Honorable Prime Minister Sri Narendra Modi ji has written an introduction. And this is myself presenting that book to the Honorable Prime Minister. This is the introduction. You can see it's a book on muscular dystrophy, and the Honorable Prime Minister has written the introduction. Here is a small video of a Prime Minister of a speech he made in Parliament.
तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट यामाहा को मिलने गया। मैं इसलिए किया गया, उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है। हम गए तो वहां गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें.
So here is the Prime Minister of India in the Indian Parliament talking about the importance of stem cells. Now, what is a better way to highlight the importance when a Prime Minister actually talks about a treatment modality in Parliament? That just shows how important he believes it is. That was a general introduction to stem cells. Now we will look at how we do this treatment. So basically there are 3 steps. The beauty of this treatment is the sheer simplicity. It's very, very simple to do. The first step is we take a needle and we put it into the pelvic bone, that is just above the hip bone. And we put the needle in the bone and we pull out the bone marrow from the bone. This is called bone marrow aspiration. It takes about 15 minutes. The child is given a sedation, so the child is sleeping. We give local anesthesia, so the child has no pain whatsoever. All right. Once we've taken this out, we take this to our laboratory where it takes about 4 hours for us to separate the stem cells from the bone marrow. So what have we taken out from the bone? The bone marrow. The bone marrow has got many types of cells. It's got red blood cells and platelets, and it's got plasma, and it's got stem cells. So we have to separate it. So that takes about 4 hours. And once we have the stem cells, we then inject it into the lower back. Like I told you, why in the lower back? Because the fluid in the lower back takes it directly to the brain in a few minutes. So in the whole treatment, there are only 2 needle pricks. With one needle prick, we aspirate, and with the second needle prick, we inject. So let's watch a video of how this is done. Here you can see the child is sleeping. This is the bone marrow aspiration. We take this to a laboratory. And here you can see with a very thin needle, we are injecting the stem cells inside. Since this is important, we'll watch this video again. So this is the bone marrow coming out. This is taken to the laboratory. We have sophisticated machines that count the number of cells. And this is how we inject it with a very thin needle into the lower back. These are the stem cells. And this is a very, very thin needle. This needle is thinner than the needle with which we collect blood, for blood testing. It's thinner than that. So that's all it is. Again, still pictures, bone marrow aspiration, taken to the laboratory. The cells are studied, and with a very thin needle, we inject it back. So the reason why I'm emphasizing this a couple of times is to let you know there is no surgery involved. There is no operation involved. There is not a single cut. There is not a single stitch. Just 2 needle pricks. And what are we putting into the child? We are putting the child's own cells, good, healthy cells from the bone. After we have filtered them, taken the stem cells, we are putting it back. So there is nothing from the outside. There is nothing artificial. This is natural healing. So now I understand, I was told that a large number of parents who are participating in this have children with autism. So we're going to look a little bit at autism and what exactly autism is and how stem cells can help, because it's very important as parents that you understand what exactly is happening inside the brains of our children. Because when you know what is happening, it gives you knowledge. That knowledge gives you power, and then you can choose the right treatments for your child. So understanding is a very key step to helping our children. So we're going to spend a little time trying to look at what is autism. So autism is a neurodevelopmental disorder. It was first described by Dr. Kanna in 1943. Normally, you diagnose it in the first 3 years of life, and we classify it as mild, moderate, or severe. Now we don't use the word autism. We call it autism spectrum disorder. So we refer to it as a spectrum disorder. The symptoms primarily are broadly of 3 types. There is problem with communications and speech. There's problem with social interaction, and there are certain repetitive behaviors. So this triad comprises of what autism is. Now, the incidence of autism, in 2004 was 1 in 166 kids. And in 2020, it has gone up to 1 in 54. That is a huge increase. We've never before seen any, disorder or problem in children increase so rapidly in such a short time frame. And which means that today there are 70 million people on the spectrum. 70 million, it's 1% of the world's population. Most people don't realize that 1% of the world's population has autism. This is not a small problem, but it hasn't got the attention it deserves from governments, from regulators, from bureaucrats, from scientists and doctors. 1% of the world's population is not a small amount. So and it's increasing. Every year the incidence of autism is increasing. A question that parents keep asking: why my child? Why did my child develop autism? We'll very briefly look at that. I may not be able to give you the answers to why your child has autism, but let's look at all the possible causes. This is in particular for those people who are planning to have another child and would want to know why their first child had autism. So broadly speaking, we classify them into four main causes. Let's look at each of these. So the first is problems during pregnancy or birth. So any infection the mother may have during pregnancy, or any disease like diabetes, or polycystic ovarian kidneys, or mothers who smoke, the incidence of autism is a little higher. One important thing that we miss out is the emotional health of the mother. What we are finding is that mothers who are stressed out during pregnancy, who are anxious, who are going through emotional turmoil, are more likely to have a child with autism than a mother who doesn't have these things. So we focus on the physical health of the mother. We don't focus on the emotional health of the mother. The emotional, the intellectual, health of the mother is as important in preventing autism. Of course, things like smoking, polycystic ovarian disease, diabetes, and infections, these have to be taken care of. The age of the parents is also important, in particular the father. So a father at 45 years has a 3.5 times more chance of having a child with autism than a father at 24. The mother's age is important, but not that important. The father age is more. Now what we are finding is that people are having children more and more later in life due to their professional careers, commitments. People are getting married older. So this could be one of the causes why we have an increase in autism. Then gut problems. So 9 out of 10 children have gut problems. And in our gut we have good bacteria and bad bacteria, and normally we have an abnormal composition of this, and this can cause various problems. Of course, what is not clear, because earlier it was believed that the gut problems cause autism, and now there is a thinking that maybe the brain, the damage to the brain by slowing down gut movement causes the gut issues. And this is something most people are not aware of. Exposure to mobile phones. If we, when we look at the incidence of autism, ever since mobile phones have become common, the incidence of autism has gone through the roof completely. There was a dramatic shift, like before mobiles and after mobiles. Now, is this the use of the mothers who are pregnant? Because when you hold a mobile phone emits radiation for a very short distance. So when the phone is close by, the child could possibly get radiation. Also, you have these, towers that emit very powerful radiation everywhere. And we know how this affects. What happens is that our brain has got a protective system called the blood-brain barrier. And the radiation and what the blood-brain barrier does is it prevents harmful substances from entering the brain. It's like a security guard. Only the brain has this. No other organ in the body, the heart, the liver, and kidneys, they do not have a protection system, but the brain does. And radiation from mobile phones, when a child is exposed to in the mother's womb, actually damages that, which means the security from the brain is lifted, and now unwanted, toxic, impure things can enter the child's brain. Heavy metals are an important cause. So lead is one of the most important things. We are finding that, high levels of lead in some of the children. In fact, in a study conducted by an Australian university, In India, they found very high levels of lead in many of the children who had intellectual disability and neurodevelopmental disorders. This was research done in India by an Australian university. And among the other things, I mean, there are many things which can cause. So there are foods, but one important thing they found is, some of the noodles and spices that had a little higher level of lead. So these are things you have to be careful of. Then mercury, aluminium, these are also known to cause damage to the brain. Vaccines, this is something controversial. In 1998, Dr. Wakefield had proposed that the preservative used in vaccine could cause autism. This caused a big furor in the medical world. And then later, there were about 25 articles which said that vaccines do not have a connection. This is a very controversial area. There are a lot of arguments about this, whether it does or it does not. But as a medical professional, let me tell you one thing. It is very important that we vaccinate our children, because the danger of not vaccinating is much, much more than the danger of vaccinating. So we should not stop vaccinating our kids. Now, what is really new and exciting in the world of autism is that for the first time in medical history, we are now understanding which parts of the brain are damaged. And this is original research that we have done. We have done this in more than 3,500 children so far. These are special scans called PET-CT scans, where the blue part is the part that is damaged. And we've done this, and every child with autism has this blue hypometabolic part. As part of our research, we studied the brains of some normal children, and not a single normal child had this. Not a single normal child, but every child of autism had this. And this corresponds to the symptoms or problems in the child. And this work of ours is published in a prestigious journal called the World Journal of Nuclear Medicine, where we've actually shown what are the changes in the brains of children with autism. So the results of what I'm telling is published in an international journal by us. What we found, surprisingly, and we were surprised to find this, is what we found is that in normal children, so this is age 0 to 5, 5 to 10, and this is the brain value. The higher the SUV, the more the brain is working. So normal children, their brain value is a particular one, and with age, it keeps on increasing from 5 to 10 years to 15 years. In normal children, the brain activity increases, but in children with autism, we found it keeps on decreasing. So we did not know this till we did our own research, because we compared brains of normal children with autism. Now, why is this important? This is important because, see, we want, if our special needs child's brain is going like this, what do we want? We want it to become like this, right? We want it to grow like normal children. Now, if you treat here, you have to only bridge this gap. But if you treat here, you have to bridge a much bigger gap. I hope you understood that. So that is the importance of early intervention, because people say, well, let's wait till this treatment is, more established, more known, everybody gives you all kinds of information. But this is our children. And we must realize that the longer we wait, the more the brain activity is going to go down, and the more difficult and challenging it will be to get to this normal. So the earlier we treat, the better it is. So are we doing enough? I mean, are we doing everything that we possibly can? We are doing all kinds of rehabilitation, but despite that, the fundamental damage in the brain is not being repaired. So here's the role of stem cell therapy. And this is our data from 700 patients, where we have 89, that's almost a 90% success rate, of which 33% of the kids had a significant improvement. That means they no more are on the autism spectrum. Their autism has been reversed. That is 33% of our patients. 29% had a moderate improvement. That means they improved significantly. They became independent, but they are still not off the spectrum. They still have some symptoms. 25% had a mild improvement. That means they've improved in some things, but they are still dependent. And about 10% of our patients did not improve. Now, when we analyzed the data, we found that this is age dependent. So all these kids who improved significantly, they were all below 11 years of age. They were actually all before puberty. Puberty is the time when, a boy becomes a man, starts getting mustache, beard, sexual organs develop, and in girls, they start getting their menses. So we found that when you treat before that, you can almost completely reverse it. This mild and moderate, this was kids who were in the 10 to 20 age group. And almost all the kids who did not improve, 10%, they were all over 20. So this very clearly shows that the earlier you treat the children, the better are the chances of getting them a close to normal life. And the symptoms that improve are everything from social relationship, emotional responsiveness, speech and language, behavior patterns, sensory aspects, cognitive improvements, hyperactivity, attention, concentration, eye contact. So this is showing the percentage of improvements. Now, the world's first scientific paper on the role of stem cell therapy in autism has come from India. And I feel honored to say that it has come from our institute. We published this. So the world's first paper on cell therapy in autism comes from India, and it has been written by us. Now, this is objective proof of improvement. So above what you see, this is a horizontal section, a front section, and a lateral section, and everything that is blue is hypometabolic or brain that's damaged, not working properly. And 6 months later, you can see that after the stem cells, there is a significant and dramatic improvement. A significant and dramatic improvement. Okay, look at that. So this is objective proof that the damage in the brains of our children with autism can be reversed. Now, your doctors, your therapists, they will tell you that it can't be done, but we have proof. I'm showing you 2 or 3. I have 3,500 such scans. 3,500 scans of before and after, showing objective proof that we can reverse autism. Our children do not have to suffer living lives with these damaged brains. They don't have to. We can, through a very simple technique, just 2 needle pricks and cells taken from the child, just 2 needle pricks and cells taken from the child and put back into the child can reverse this damage. Let's give us our children a chance to live normal lives. This again shows you a scan. Above, you can see the damage, and you can see below the damage is resolved. You can see again above and below. You can see here again, look at this extensive damage before, and you can see that afterwards this damage is gone. And then then people question us, you're doing this at 6 months. How do you know that after 1 year, 2 years, 3 years, this blue doesn't come back? So in a few children, we did this year after year. This shows you 2012, 13, 14. You can see this is the damage before, and you can see the next year it is significantly reduced, and in 2014 it's even more reduced. So we have actually shown and proven that this improvement is progressive and sustained. It's not like it improves and becomes bad again. Over the years, if you do scans, the improvement continues. This is another paper of ours, which, this is published in the American Journal of Stem Cells. It's a prestigious journal, the American Journal of Stem Cells. And this was published, in 2019. And this has a little more extensive data. We presented data of 254 patients. And here you can see the improvements in different aspects: social interaction, eye contact, attention, stereotypical behavior, aggressiveness, hyperactivity, self-injurious behavior, sitting tolerance, command following, speech, communication. So all these things it improved. And when we took the average scores, there are some scores like ISA and cards. You can see the score before 108, and you can see the mean. This is an average of all the patients before and average of all the patients later. You can see that there is a big difference in the scores. And this is just to show you that we published the world's first paper. This was our paper, right? And then the second paper came from China, the third from Italy, the fourth and fifth were from America. The sixth one again was from us. The seventh from Panama, the eighth from Vietnam, the ninth from Iran, and the 10th from the United States. So, as you can see, this, we have leadership here. And this is something, that can never change. When you're the world's first, you're the world's first. But, the rest of the world, including the United States, is catching up with us. And apart from, the world's first paper, we have several other papers. We have 15 papers. You already saw some of these videos, so I won't, you saw the video in the beginning. We have small, videos of the child from United States that you just saw. There's a child from the UK. There are these triplets from Africa, a boy from India and a girl from Australia. But I think I'll run through this. Maybe I'll just show you the triplets. You've already seen Ganesh. Here's a story of, I understand as parents, how difficult and stressful it is to manage one child with special needs, right? I mean, it's obviously the most difficult thing to be able to go through life on a day-to-day basis with one child. Here is a small story of a mother who had triplets, all three of whom had autism. And let's see their story very briefly.
We went to different doctors, we went to different hospitals. And when I brought it up, they were like, oh, no, don't worry. It's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye. And no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, takes a few minutes, and he is asleep.
You see my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day, and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop?
Yeah.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
And let's just see this small little bit of one of my earliest childs I treated from India. He's now 15. I treated him almost 8 years ago.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me and I wondered why did this happen only to me.
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on the feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade.
He passed his 10th standard in school and now studying in
There
college.
have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
He's taking tuitions of other, deaf children. He's a deaf child. So a child who could not talk is today taking tuitions for deaf children, which is a very difficult and challenging thing. So he's actually earning a living now. He's studying and he's earning a living teaching deaf children. Now, that was about autism. We will look a bit at cerebral palsy. So in cerebral palsy, there is damage to the brain, but the effect is seen more in the body. In autism, the effect is in the mind, in behavior and communication. In cerebral palsy, there is weakness of the limbs, difficulty in walking, using hands and legs. So it is basically caused by brain damage that happens during the birth process. And there are different types. It can affect just one limb, one half of the body, only the legs, or the entire body itself. And there are different terminologies depending on where the damage is. Spastic, dyskinetic, ataxic, etc. Now here, if you look at the scans, you will see the brain damage in cerebral palsy is much more severe than autism. In autism, you saw blue, but here it is darker and it is more widespread. So the damage is a little more in cerebral palsy as compared to autism. Currently, again, there's no cure for cerebral palsy. There is just rehab. There are a few treatments. You can treat the epilepsy, the spasticity. There are some surgeries that we can do. There's the use of orthotics. But stem cell therapy actually repairs the brain damage. So this is our data from 600 patients. Again, we have a little over 90% success rate. 20% had a significant improvement. That means almost all their deficits went. They're living normal lives. 41 had a moderate improvement. That means they became independent, although they still have a few deficiencies. 30% mild, 9% did not improve. But in cerebral palsy, there is no age correlation. This does not depend on age. It depends on the severity. And these are the symptoms that improve from drooling, oromotor drooling, balance, upper limb, lower limb movements, tone, activities of daily living. This is just to show you the improvements. And here is the proof. a scan before, you can see all this blue area which is damaged, and you can see after the stem cell therapy, the damage is gone. So this is again proof that the damage of cerebral palsy can be reversed as well. Here you can see the damage, very extensive. It's more than that in autism. And this is after the stem cell, it is significantly reduced. Our work is again published in an international journal. Of course, it's not the world's first in autism. We have the world's first paper. In CP, we don't have the world's first paper. Somebody's published before us. But our work is published in scientific journals, in the journal Stem Cell International, the study of bone marrow cells for cerebral palsy. And we have several other papers as well after that. Here, just a video of this child who from Kenya, who was totally wheelchair bound, and you can see the improvement. He's from Nairobi. He had quadriplegic CP, that both hands and legs were affected. He was unable to sit, stand, walk independently, totally wheelchair bound. And now you can see after the stem cells, he's sitting by himself, which was not possible before. He's using his hands. He's able to wear a T-shirt. He's able to, he's able to stand, open a refrigerator, use his hands to take out a bottle, open and drink. It may be a small thing for others, but for a parent, it's huge. A child who was totally dependent. You can see here, from totally wheelchair bound, he's now able to walk independently. So we can free our cerebral palsy children from a wheelchair life. We can put strength back into their legs and hands. We can give them functional independence by repairing the damage in the brain. Cerebral palsy children no longer need to be dependent. Once the brain damage is repaired, the tightness in the hands and legs goes away, the strength in the hands and legs comes back, and they are able to live independent lives. Then intellectual disability, this was earlier referred to as mental retardation. Now we don't use that word anymore, so it is called intellectual disability. Here again, there's a problem in the brain. I'll show you now. Here you can see the damage is a little less. In CP you saw it was dark, and here it is much lighter. So in ID, the damage is a little milder as compared to CP. And here are our results, which show a 84% success rate, 20% significant improvement, 25 moderate, 39 mild, and 13% do not improve. These are results with stem cell therapy. And the functions that improved were cognition, memory, problem solving, understanding of relationships, social inhibition, and toilet training. This is what improved. You can see that out of 16 people who were not toilet trained, you can see 13 became toilet trained again, so on and so forth. And the world's first scientific paper on stem cell therapy in intellectual disability has been written by us. You can see this paper in the journal Stem Cell Research and Therapy. And here is evidence. You can see above is the damage. You can see it, in two views. And below you can see after stem cell, the damage is gone. So again, objective proof of the fact that the damage in intellectual disability, and sometimes they have, they have delayed development. So they're different. There's GDD, there's global delayed, there's, different people use different words for things, but eventually the problem is all some amount of damage in the brain, and you can see that it is improved. And we have a total of 5 papers on this subject. So here was this girl, 26-year-old with intellectual disability, and you can see the improvements that she had. But more than this, she had a lot of functional improvements, in terms of her ability to do many things which she could not do earlier. She participated in a cooking competition, and she actually won a prize in that.
Very nice. Very good, looks good, and with stew, perfect combination.
So, a child with intellectual disability who was dependent today plays the sitar, performs Bharatanatyam, and won a prize in a cooking competition after stem cells. So a question that as parents, I'm sure that is in your mind. How safe is this treatment? You say, well, Dr. Sharma has been telling us all the good side. What's the false side? Is there any danger, any risk? And this is a very valid and a very, very important question. Now, what we have seen, and now we've done 3,000 children with autism, we've done about 3,500 children with autism, 3,000 cerebral palsy, and many other conditions, muscular dystrophy, intellectual disability, Down syndrome, adults with paralysis, spinal cord injury. We've done a total of more than 10,000 patients. And we found that there are no major adverse events or complications, no neurological deterioration due to the stem cells in any of our patients. So there is a major adverse event is something where something the child could do before, the child cannot do afterwards. And that never happens. So you have my assurance in that there will be no major side effects. Now, there are certain minor side effects. For example, some kids have epilepsy. 3% of children who already have epilepsy, they may have an increase in epilepsy in the first 3 months. So this does not happen to children who don't have epilepsy. But if children who have, like they get 1 or 2 convulsions of every month, that can increase to 2 or 3 in the first 3 months, but it gets controlled with medicines. 10% of our patients get a spinal headache immediately after the treatment. This lasts for 2 days. It's a peculiar headache, which results in the child having a headache on sitting. But the moment the child lies down, there is no headache. This lasts for 2 days. It happens only when you're in the hospital. It never happens once you go back home. Some kids may have a little nausea, vomiting, etc. One thing that happens that we don't mention it as an adverse event is some of the kids get a certain behavioral issues. They become hyperactive for a short period, 2 or 3 months after the stem cells. Now, this is not an adverse event because for the parents, it is suddenly that they see the child is a little hyper more than before. But actually, this is a sign of the brain recovering. When we put in stem cells, it stimulates the brain. And as the brain gets stimulated, activities increase. And what may appear to be unpleasant for the parent is actually a sign of the brain recovering. But this goes away after 3 months and the children do settle down. So along with stem cell therapy, we combine our treatment. If you remember the beginning, I spoke to you about cell therapy, rehab, and integrative oxygen-based therapy. So we finished the stem cell therapy part. I will now briefly look at the comprehensive rehab. Now, the rehab is extremely important. And why is it important? Because if the brain is like a computer's got hardware and it's got software. Stem cell therapy only fixes the hardware. The software will come from rehab. So rehab is a very, very important part. And when you come to us, we have a very comprehensive rehabilitation program. There is physiotherapy, and we have, this is a physiotherapy department. We have occupational therapy. So then we have, a dedicated autism child development center. We have a dedicated, this is a special autism, this is all in our hospital itself, special treatment areas for autism, specially designed for these kids. We have a spinal cord injury walking track. So this is a track where everybody who's on a wheelchair is made to walk. So in our place, people come on a wheelchair, but we insist that before they go, they get back on their feet and they walk. There's a special type of occupational therapy called sensory integration. So, we have that facility as well at our place. We have a special area for teaching activities of daily living, like clothing, bathing, the kitchen and all that. So we have a special ADL section. And then there are, of course, all these, there's speech therapy, which is a very, very important part of autism. And then there is special education. There is dance therapy. And, so we have all these therapies combined, which we not only do for the children, but we also teach the parents how to do this at home. Now the third part is what we call integrative therapy. So we have a combination of various therapies, which we have now added. We've been using this for the last 1 year. I'd like to discuss a little bit about that. So these are all called integrative therapies because they're a combination of different therapies. The most important of which is this one is called hyperbaric oxygen therapy. Most of you know it as HBOT. What exactly is hyperbaric oxygen? So when the air we are now breathing, you're all sitting, you're breathing normal air, I'm breathing normal air. When we breathe normal air, oxygen gets, it goes into the blood. It is carried only by the red blood cell of our blood. So this is a blood vessel. Our blood has got red blood cells, white blood cells, and there is a liquid. This is a watery liquid called plasma. So the blood consists of the plasma, liquid, red blood cells, and white blood cells. Only the red blood cells carry oxygen. But when we give oxygen under pressure, the oxygen goes into the plasma, it goes into the liquid. So the entire liquid is now carrying oxygen. And so this oxygen goes to the littlest, most cornermost parts of the brain. It goes everywhere. So this is what happens when you give hyperbaric oxygen. So basically, it results in brain activity increasing significantly. And this is how it is. It's a chamber. This is the HBOT at our institute. The parent goes in with the child. There's a TV screen there. They can watch their cartoons, or you could just go to sleep. It's extremely comfortable, and most people find it very, very relaxing to do this. The session lasts about an hour or so. Then we have, there are different improvements that happen using hyperbaric oxygen. The entire metabolism increases. Then we have ozone therapy. So this is oxygen is O2 and ozone is O3. There's an extra molecule of oxygen, and it is given in different ways. You have to just sit in this chamber, and the ozone is given. You can breathe it, through oil. And basically, what ozone is it is very strong. It reduces inflammation. It also thins the blood a little, so more blood can flow. It kills any virus, bacteria, fungus, etc. And we've used ozone extensively. For 6 months, our hospital had become a COVID hospital, and we used ozone extensively in COVID with very, very good results. But we are finding it works very nicely for autism, cerebral palsy as well. It sort of reduces inflammation and activates the antioxidant system of the body. Improves oxygenation everywhere, improves the gut health as well. You can give it through the ear like this, or you can breathe it. It can be given in a chamber, or it can be given intravenously. We also have acupressure. We find that giving acupressure to children with autism, it actually results in a lot of improvements, a lot of relaxation, especially in the behavioral issues. So this is our institute where we are doing our work, the NeuroGen Brain and Spine Institute, which is dedicated for this purpose. We have treated more than 10,000 patients from over 70 different countries, from all the 6 continents of this planet. So from 70 different countries, people have come to us. We are located adjacent to the sea. We have a very beautiful, from our building, there is a lake and a sea view just outside of our building. This is our operation theater where we do the work. This is our stem cell lab. It's among the best equipped stem cell labs in the world. We have the finest equipment. This is the hyperbaric oxygen chamber. We have 2 of these actually now. There's the ozone therapy. We have machines for cleansing the gut, hydrocolon therapy. We use intravenous vitamins and various other intravenous therapies. So we've written several books. As you can see, there are 12 books that we've written. We've written books for doctors, books for parents, books for therapists, and all these books are distributed free of cost. I mean, hard copies and soft copies. You can download these from our website. Our core team consists, apart from myself, of Dr. Nandini and Dr. Prerna, who are the stem cell experts. Dr. Jacob is India's senior most neurophysiotherapist. He supervised the rehab program. And Dr. Himangi is a physician from the United States. She did her MD in America. She was working in America when she developed a disease called motor neuron disease. In America, they told her there's no cure. They said she had only a few months to live. So she came to India to me. I treated her. That was 12 years ago. And she's well and improved and heads our research facility. She is a living example of the power of stem cells, because in America, they told her that, you're going to die in a couple of months. And when she came to India, we treated her and she has proven them wrong. She's now heading our research. We believe in quality control. So our laboratory is good laboratory and good manufacturing practice certified. We have an ISO certification. We are certified by the European Medical Association for best medical practice. So this is a European accreditation, and we've been selected the best stem cell therapy center in India at the National Healthcare Excellence Awards in 2016. Once again in 2018, this was given to us by the Minister of Health. In 2018, again, we were the best institute for stem cells. We got the best stem cell therapy center in our state, Maharashtra. This is the chief minister of that time giving it to us. There are certain very prestigious awards like the Rose of Paracelsus Award, which comes from the Socrates Nomination Committee of Oxford, and it was given to us at Cannes. This is given for exemplary and innovative research work. Now, and there are several other awards. I can't go into all of them. If you want to reach us, you could visit our website. That's www.neurogenbsi.com, or you could email us at contact@neurogenbsi.com. You should get a reply within 30 minutes by a doctor. Emails are not replied to by clerical staff. A doctor will reply to you. You can WhatsApp chat, audio, video call, or you could call this number. That's 9920-200-400. I'll repeat that, 9920-200-400. Or you could set up a WhatsApp video or a Skype interview through a prior appointment. Once you decide you want to do the stem cell, you're appointed a specific coordinator who becomes a one point of contact for everything and will assist you through the entire process till you arrive at NeuroGen. So I'd like to conclude by saying that adult stem cell therapy, what we use, it's called adult, is then children also. Adult means from the body of the child, is a safe and effective. If you notice, safe is before effective for autism, cerebral palsy, and several other pediatric neurological disorders for which currently there is no treatment. We heard the Prime Minister of India talk about stem cells. So the world's two biggest democracies are India and America. And now let's hear what the President of the United States, the former president, had to say about stem cells.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So I'd like to end with that. So here, the leaders of the world's two biggest democracies are talking about stem cells, Prime Minister Narendra Modi and President Obama. So with that, I'd like to thank you for your attention. I'm now open to any questions, so you can feel free to ask questions. You could put them up on the webinar. So I'll start reading. S. Sarup says, hi, does stem cell therapy help kids with microcephaly? My daughter's 2 years old and she's 9 kg and she has jerks. Swaroop, yes, it does. So our treatment will not reverse the microcephaly, because microcephaly means the skull is small. But in the skull, the brain which is there, it is going to, it will improve the functioning of the brain. And as the functioning of the brain improves, you are going to get improvements in all the higher functions, understanding, cognition, hand and leg movements, etc. So once we do a scan of the brain, we will understand how much of the brain is working and how much is damaged, and then we can answer your question. So the answer to my question is yes, stem cell therapy can help your daughter, but will help your daughter improve the brain function It will not help in improving the microcephaly, because microcephaly is the skull. The skull is small. The stem cell does not affect the skull. Shobha Mohan says, what could be the possible improvements in genetic disorder kid? So they are, again, our treatment, Shobha, does not, cure the genetic problem. What it does is it repairs the damage caused by the genetic disorder. So one is to cure the genetic disorder, which stem cells don't do, but the genetic disorder has caused a damage to the brain, and that is repaired with stem cells. Priyanka Pandey says, hi, good morning. We did 2 shots of stem cells for my 6-year-old autistic son. Second one 9 months back. Still his impulsivity and restlessness sustained. Are there any herbal or organic medicines available to reduce? No, in fact, we should not be using herbal or organic medicines. And like I said, there is, I mentioned that, some kids have certain, their restlessness, hyperactive behavior is actually a sign of the brain recovering. As the brain recovers, you sometimes see this. And what this does need is a certain amount of behavioral therapy. Definitely not organic or herbal. And now what we are finding is that we have now combined our stem cell therapy with hyperbaric oxygen and ozone. And with that, we are finding all these issues of impulsivity, restlessness are overall much better. So the combination, so I'm repeating, parents think stem cell is the magic. No, stem cell is an important part. But with that, we need to do proper rehab. If you haven't done rehab, we will not see results. And now we are saying that when you combine hyperbaric with, and ozone therapy, we get still better results. I hope I answered your question, Priyanka. Prasarthi says, is it a single time procedure or multiple times? So this depends on the amount of damage, Prasarthi. If when we do that PET scan, that blue that we showed you there, it's either mild, moderate, or severe. Now, if it is mild or mild to moderate, then it requires a single procedure. But if it is moderate to severe, then it may have to be done twice. If it is very severe, then it may have to be done 3 times. So, but not more than that. So, the number of times the procedure is done will depend on the amount of damage, which we can tell you once we do the PET scan. Divya Vishwa says, how many times can we poke the brain? What is the recommended frequency time between each treatment? So Divya, first thing is you asked how many times can we poke the brain? We do not poke the brain. We do not even touch the brain. We don't go anywhere near the brain. We inject it into the spinal fluid in the lower back, and the spinal fluid takes it to the brain and does the repair. The recommended frequency time between each treatment is a minimum of 6 months. So you cannot do the second treatment before 6 months is out. That is our protocol. I hope that answered your question, Divya. Then Madhuri Nadampali says, how second shot will help? My son improved a while, but I feel his OCD is back after 9 months. So the second shot definitely helps in that, because what we are seeing is that when we do it one time, there is a partial improvement in those where it is moderate to severe. And then when we do it the second time, then we have improvements of everything. So we do have parents who tell us that the son improves, but some of these behavioral issues are still there. I explain, and I'm explaining again, some of the behavioral issues that we think are a problem are actually a sign of the brain recovering, a sign of the brain improving. So I think, Madhuri, the second one will help. Madhuri Nampali, is HBOT in the same hospital? Yes, now it is. Actually, earlier we had HBOT in another hospital of ours that was adjacent, but now we've installed HBOT in our own hospital. So you don't have to go outside now we have HBOT right here, starting from this week onwards. The machine was just installed on Ganesh Chaturthi about a week ago. Kumar Sharma, can the integrative therapy be given during the first week of rehabilitation? We normally, we have a program. What we do is we give stems. So you have 2 options. You can do just the stem cells and rehab for those people who can't stay for long, and that's a 1-week program. And for those who can stay for 15 days, then we combine it with 10 days of HBOT and ozone and integrative therapy. So it can be given, but there is no point just giving 1 or 2 because that doesn't serve any purpose. You have to take at least 10 sessions of it to have a benefit. So it all depends on how much time you can stay with us. If you are staying with for 1 week, then you will get just the stem cells and the rehab. And if you stay for 15 days, then we give integrative therapy with that. Shilpa Maheshwari asks, how is ozone therapy delivered in a child of age 5? So we give it 2 ways. We give it through the ear. You saw that we put a stethoscope in the ear and that is connected to the ozone. So that is one way. And we also give it through the rectum, through the passage of the stool, how we give an enema. So we pass a rectal catheter and the ozone goes inside and it has a gut cleansing effect. Bora Rani asks, can we do PET scans locally and come over? Yeah, sure, you can do the PET scan locally. But you must do the PET scan at a place where they do brain PET scan. What happens is that most PET scan facilities, they are whole body scans and they don't focus specially on the brain. But if you can get a PET scan which is focused on the brain itself, then we are fine if you do it anywhere and come over. But please, you should communicate with us because it shouldn't be that you do a PET scan, which is a whole body scan in which only the brain is a small part, and we don't get to see what we want. And then when you come here, then we have to repeat it again. So we don't like that. So if you're doing a PET scan, please talk to us. We would like to talk to your PET scan center and ask them if they are doing a PET scan the way we want it. Madhuri Narampally says, does stem cells fix gut dysbiosis? So what we have found is a lot of our children had gut problems, and when we did the stem cells, the gut problem disappeared. We had kids who would eat mud, eat their own poo, they would eat chilies, entire packet of red chilies, salt, anything, and when we do the stem cells, for some reason, this completely disappears. It doesn't stop. It disappears. It's gone. And so, we could understand because we are repairing the brain and how come the gut issues are solving. And then now we believe that the gut problems are because directly connected to the brain problem. You fix the brain problem, the gut dysbiosis seems to settle. Having said that, we've recently also introduced ozone per rectum. So that helps definitely in fixing the gut dysbiosis. Kumar Sharma says, people traveling from US has to take a long flight to India. Travel with autistic kids is difficult. It has become more difficult during pandemic. Is there any suggestion to make the travel more calm by use of a medicine during or prior to travel? Yes, we have. There are medicines that we can give. So if you communicate with us, we will advise you what medicine, but we'll need to know the weight of the child. We'll need to know what other medicines he's taking. And so there are medicines and we do prescribe them, but we need to know some details of the child before we prescribe these medicines. Ajay Masand asks how stem cell therapy can take care of the following. MTHFR, where C16-7 mutant is detected, remove MMR and other vaccines overload, HMT, how it can remove heavy metals, gut healing. All right, so Ajay, the question, I said this before and I'm repeating it. Stem cells do not repair the genetic defect. Stem cells will not remove the heavy metals, okay? What stem cells do is they repair the damage caused by the heavy metals or by what you think is vaccine overload or by the genetic defect. So stem cell repairs the damage. Okay. Now, the genetic problem, it has done the damage that it had to do. Okay. The heavy metals, they've done the damage. So it helps over there. About gut healing, I just explained to you what we found is that, and we didn't know this earlier, that when we repair the brain damage, the gut movements improve because the brain controls everything, including the gut movement. So when before the stem cells, the gut movement is slow. When the gut movement is slow, the food that is ingested, it takes a longer time to pass. And so it remains in the body longer. And then that becomes toxic because the material, waste material, which should be going out remains longer. Once we fix the brain damage, what we have found, and we didn't know this earlier, is the gut movement improves, and now all their gut issues, sort of seem to heal. So out of your 4 questions, stem cell therapy does nothing to the MTHFR or the MMR vaccine or the heavy metals. It repairs the damage caused by them, but it does help in the gut healing. Question 2 is, life of the stem cell injected. So the stem cells don't remain stem cells. Stem cells are like seeds. When you put seed in the soil, they don't remain seeds. No, the stem comes and they become flower, leaves, fruits, everything else. So stem cells, when you put them inside, they don't remain stem cells. They convert into neuron cells, at the end of 6 weeks. And I showed you a picture of our laboratory research. We showed you very clearly that the stem cells do not remain stem cells. If they remain stem cells, they have no use. We want them to become stem cells. We want them to become nerve cells. So, and once they become nerve cells, well, then they live forever, because now they've integrated into the brain. The dye quality use of PET scan, the quality is excellent. We have a Bhabha Atomic Research Center, and we get the best quality dye that can be approved. It's medical grade dye. It is thoroughly checked. It is approved by government agencies. So there is absolutely no problem with the quality of the dye used for PET scan. Bora Rani asked, everything you spoke today, is it part of a single monetary package? Yes, we have fixed packages. Unlike other hospitals, we don't have a billing system. So when you come to us, there is a fixed, and we have 2 options, a 7-day stay and a 15-day stay. And so if you take the 7-day stay, it includes the stem cell and the rehab. And if you take the 15-day stay, it includes the stem cell, rehab, and integrative. Right? Manjula, whether the volume of cells extracted is related to the percent of improvement seen. If you only get less volume of cells during extraction, whether that setting goes ineffective. No, Manjula, it's not like that. There is no limit to the amount of cells we can extract. We have a needle, we can extract as much as we want, but we only take what we need. So we've never, in 10,000 patients, we've never had an opportunity where we got less volume, because the bone marrow has got lots of, we don't need so much. What we need, we always get it. And so your question, does it go inactive? That is ineffective. That's not accurate. Sunita Nagineni says, hello, Dr. Alok, we appreciate for everything you do. Thank you. Can we get stem cells for kids going through SDR surgery? Yes, there is no problem. We can get, there's no problem with getting stem cells for a kid who's, went through SDR surgery. There's no problem at all. We can give stem cells. Kumar Sharma, what if the child is not improving after the 3rd shot? What are the medical options parents might have? So what we are seeing is that when we combine it with hyperbaric and ozone therapy, we are getting results. So HBOT, ozone, acupuncture, we've added all this in the last 1 year. We weren't giving this earlier. We are now finding that when we combine these 3, almost all our kids improve. Now, some of the kids who don't improve, what we have noticed is they're not getting enough rehab. So you need proper rehab, you need occupational therapy, you need speech therapy, you need behavioral therapy, you need psychology, you need special education. So if that is not being given, because like I said, the brain is like a computer's got hardware and software. Stem cell only fixes the hardware. It doesn't put software. So if you're not putting in appropriate software, you will not see the kind of improvements that we expect. Priyanka Rani says, my son is autistic. Will stem cell help in increasing his social understanding? Absolutely, Priyanka. What we've noticed is a lot of our kids, they improve a lot in their social understanding. They integrate into society. They, whether it's play or whether it's fun or whether it's education, whether it's social events or functions, they increase their social understanding tremendously, Priyanka. Archana Shukla Dikshit, so Archana here, Varuni's mom. So should we go in for 20 HBOT session? Yes, 20 is good. If you can do 20, that is the best of all, Archana. Hi, I hope Varuni is doing well. We all miss you here. We remember Varuni was so wonderful when she was at NeuroGen. Yes, I think, Archana, you should go in for 20 HBOT. That would be good. Shilpa Maheshri says, can HBOT and stem cell together be too much of activity for the brain and can trigger epilepsy? That's an important question, Shilpa. So children who have a history of epilepsy before and whose EEG is abnormal, there it could happen that it could trigger epilepsy. So if there is a past history of severe epilepsy, then we are very cautious. Sometimes we don't combine it. In children who've not had epilepsy, this risk is not there. So it all depends on whether they had epilepsy in the past or are regularly having epilepsy, or they've never had epilepsy. If they've never had, no risk. If they're having epilepsy, yes, there is a risk. Deepak Soni says, is there any negative impact on the child's mind or body after the stem cell? No, there is absolutely no negative effect. We've not noticed anything. On the body, absolutely none. On the mind, sometimes they have behavioral issues, but this is it's temporary and it's a sign of the brain recovering. But we've never had any harmful effects. Shahnaz Khan asks, is there any test to diagnose autism in the second child during or before conceiving if the first child is autistic? What is the test name? Well, actually, Shahnaz, there is no test to diagnose autism if you're going to have a second child. I mean, there are some genetic tests that you can do, and they will tell you if there is a genetic defect in either the mother or in the father. And so this is before. Okay, you can test the mother or the father and see if there's a genetic problem. That's the only test that you can do. You can't test the child once the child is conceived. During or before conceiving, there is nothing you can do with the child. There is a test called amniocentesis, which can be done, which can tell you if there is any other genetic problem in the child. So, but we don't recommend amniocentesis because amniocentesis will only give you a diagnosis, and all it does is it gives you the legal permission to terminate a child in a more advanced state of pregnancy. So apart from genetic testing, Shahnaz, there is really nothing else that we can do. But I do recommend here that, because of, this is a very important question, Shahnaz, what you asked. It's a very important question. A lot of parents ask us when they have a first child who has special needs or autism, should we have the second child? And if we should have a second child, what do we do? So what is in our hands? What is in our hands is the mother's health. And this is something we don't give importance to. So my advice is, if you want to have a second child, that's fine. It's a very personal decision. But take care of your physical health. So see that your diet, your nutrition, your exercise is good. Keep away from mobile phones physically. I know that's a difficult one. It's not the mobile phone, it's keeping it close. So if you use Bluetooth or, earphones, that is fine, but keep mobile phones away. And the mother's emotional health is very important. This is something which everybody in the family, the father of the child, the in-laws, everybody needs to understand that the mother's emotional health is very, very important. A pregnant mother needs to be handled with care, needs to be looked after, needs to be given special attention. We have to take active efforts to see that there is no emotional stress on the mother. Because when we are stressed emotionally, we release stress hormones in the body. One of them is called adrenaline. And then when the mother is stressed and that hormone is in the system, that will go to the child's brain. And then that can cause damage to the child. So my advice, if you're having a second child, look after your physical health, including diet and nutrition, look after your emotional health, and stay away from mobile phones if it is possible. That is in your control. All right. I hope I could answer your question, Shahnaz. Deepak, Shilpa, Archana, Priyanka, Kumar, Sunita, Manjula, Bora, Yuvas, Ajay, Kumar, Madhuri. I hope I've answered all your questions. There's Divya, Prasati, Priyanka, Shobha, and Swaroop. I think I've answered all your questions. If there are any more questions, I'd be very happy to answer them. And if there are none, I don't know if, All right, I see some other questions. Is the webinar on? Somebody asked, that was at 8:30. I'm unable to, I think, I don't think there are any more questions. Let's see. I can't see any more questions. I think I've answered most of Well, somebody says, will this session be recorded and can we see it later? Yes, it will be recorded, and I think you can. Where do they get it? I think they go to a YouTube channel. It will be on a YouTube channel. It's also on a. Yeah, so we will be sending to all the people who've participated, because I think your email addresses are with us. So we will send you the link of the entire thing. Vidya KVK says, what will be the prognosis for a 5-year-old child with the SCD? The prognosis is very good. What we have found is that if you do this within 5 years, the results are absolutely the best. If you do it within 11 years, you still have good results. But if moving to it after 11, the results are not good. Afsana says, do we have to remove heavy metals to get maximum benefit for SCD? No, Afsana, we don't have to remove. We've actually studied children who have heavy metals, children who don't have heavy metals, children who've had chelation and removal. And what we find is that the results of stem cell therapy are the same in both, because whatever damage had to be done has been done. It's been done by the heavy metals. So there is no need to remove them now. And I think I answered Priyanka's questions. I think these are the same question. Kumar Srini says, after we get discharged, will there be any follow-up appointments to track our parents to get in touch? No, we have so what we have is we have a case manager appointed, and you can get in touch with the case manager whenever, but they are therapists and sometimes they are busy. They may not be able to reply immediately. We've just put in place a very new system where every month you are going to get a call from us or WhatsApp from us. So we will regularly be in touch. We've created a complete separate follow-up team that will be constantly in touch with you. We have a helpline number, so if you have any medical issues, you can reach us. My number, Dr. Nandini's number, these are available. And so we're always there for you. And we have a system in place. There's an existing system in place. And now we are going to double it. So we are going to have a medical doctor. We are going to have somebody following up who's going to be in touch with you throughout. Preeti Maheshwi says, is the blue color in PET scan the only point of concern? Are all the colors okay? Yeah, the blue part, Preeti, is the damaged part. That's where the stem cells are going to work. The yellow and red is hyperactivity. That is a concern, but that is not a damaged brain. That's brain that's working more. That resolves on its own. So yes, the answer to your question, Preeti Maheshwari, is that the blue color is the main point of concern. Vinod Kumar says, how many HBOT ozone sessions are required after sitting for better improvement? So we found a minimum of 10 sessions to be useful. Less than 10 has no benefit at all. So 10 is minimum, although in an ideal case scenario, if it is possible, we find that 20 sessions, we get better results than 10 sessions. So minimum is 10, if possible 20. So we include 10 sessions in our 15-day stay. Aparna Sharat says, we stay in the US. I'm working with a biomedical doctor, seeing little improvements. How will stem cell help my son? He's 6 years old. Aparna, so a lot of our children have taken biomedical before, but you have to understand all the biomedical, it does help, but it doesn't take the brain damage away. That blue which I showed you on the PET scan, no biomedical will make that blue go back to green. No medicine in the world will make that happen. No rehabilitation in the world will make that happen. Stem cells is the only thing which can, because that's a biological damage. Those are cells that are malfunctioning. we need cells to be able to go and stimulate them and to make them active. So stem cells will definitely help your son Aparna, and we'd be happy to look after him. I think, let's see if there's anything more. I see a couple of more questions. Is it useful? I think Shaileja says, is it useful? I don't know what, I didn't understand the question. Is what useful, Shaileja? Can you elaborate on that? Can we go have TER? Lillian, you said, can we go have TER? Can we go have TER? I don't know. I didn't understand that. I'm not seeing it. Okay, Shaileja, is it? Shaileja, your question is, my son is 14 years old. Is it helpful for him to SCT at this age? So Shaileja, I showed my data. When we do it before 11, we get the best results. We can almost completely reverse the autism. When we do it between 11 and 20, that's the next best set of results. We can't completely reverse autism, but it helps. It helps the child to become independent. It improves their education, their vocational abilities. So we have treated 14-year-old kids. We have treated, older kids than that as well. So yes, it will improve, but not as much as it would improve in a child who is 11 years old. Lillian, can we do therapy in the center for 6 months? Now I can read your question, Lillian. Can we do therapy in the center for 6 months? Yes, you can. You of course can't stay in the center, but we have several parents. We do have parents who rent an apartment close by, and they come and do therapies. We've had parents doing it for 1 month, 3 months, and we have parents who've done it for 6 months as well. So you can do therapies at our center, but you have to stay somewhere outside of the center and come up and down. That was for Lillian. Afreen Jahan says, hello, Dr. Sharma. So first, thank you. I appreciate your service. I am the mother of Aram Ali 2 years ago, underwent ST in July. Post-surgery, we see positive changes like socialization, response to name. It was good. I'm happy to hear, Afreen, I'm happy to hear that Aram has improved in socialization, response to name call. You want to know whether HBOT ozone will help him recover better? Yes. So what we have seen, and we've introduced HBOT and ozone in the last 1 year only, we are finding a much, much better response when we combine stem cell therapy, rehab, and these integrative therapies. So I think HBOT and ozone will help him to recover better. Farhan Khan says, apart from SCT and normal therapy, what other options are available for treatment of autism? So, like I said, the standard is, of course, all the therapies. So that's occupational therapy, speech therapy, behavioral therapy, special education. There are so many treatments that are out there that are available. People use NEMCheck formula, and people are using camel milk, and people are using neurofeedback, and there are so many. It's like an endless list. There is diet, there is gluten-free, casein-free diet, there's ketogenic diet, there is biomedical. People are using homeopathy, and people are using Ayurveda, and so there's so many treatments out there. But what stem cell therapy does is it repairs the damage in the brain. There is no other treatment that's biological that will go into the brain and fix the damage. So we have a lot of treatments, and it all depends, Farhan, on what the problem is. So because each child is different. For some child, it's only a speech issue. For others, it's a behavioral issue. For others, it's repetitive behavior. So depending on what the problem is, we have to, individualize the treatment for every child. Manjula says, do we have to bring in any previous diagnosis or medical reports or blood workup when we come for treatment, or the child will be examined there on the first day? So the only thing that you have to do is, we need some basic fundamental blood workup to see that there is no infection and stuff. You also have to come in nowadays with a negative COVID test and RT-PCR. But otherwise, almost everything is done here. We do the PET CT scan, the EEG, the MRI. Most of the major blood workup is all done once you come here. almost everything. Just some basic things to know there is no infection or anything like that. They have to be done before. Shilpa says, will the integrative therapy, HBOT, stem cell therapy together be too much for a small child who has to recover slowly and gradually after just stem cell therapy? No, surprisingly, so that's what we had thought earlier, but what we are finding now, and it's been now almost 9 months that we've added stem cells, and we have combined ozone, hyperbaric with stem cells. The children seem to do much better. They're taking it better. They're enjoying it. They enjoy the hyperbaric therapy. They go into the chamber and they're very comfortable there. So it's not too much at all. It's actually, it's all just right. And the combination is helping faster improvements. So what we are finding is that the improvements we saw earlier at 6 months with just stem cell and rehab, when we combine hyperbaric and ozone, we are seeing those improvements at 3 months. So you're seeing faster improvements, and that is why we believe this combination will work. Now, Anand Khalid says his learning skills are very weak, muscle tone is weak, which leads to weak and fine gross motor and repetitive tasks, not independent at all. Anand, we can definitely help your child. I didn't. Your question, Anand, I can read. On my screen for some reason. All right, now I think I can read better. Anand Khalid says his learning skills are quite weak. Muscle tone is weak, which leads to weak, fine, and gross motor and repetitive tasks, not independent at all. Anand, I didn't understand your question. You made a statement. I have not understood your question. But yes, if you want to know whether muscle tone will improve, certainly. With stem cell therapy, we find that muscle weakness improves. We find that muscle tone improves. We find that, is the whole question? Because I can only see. Yeah. Okay, Anand, I now happen to, somehow I can't see it on the screen, but I can see it on the mobile. So Anand says, what is the recovery rate for and after SET? So like I told you, the recovery rate depends on the age and whether we combine it with hyperbaric or not. So our data, which was before we combined with hyperbaric and ozone, we have a 90% recovery rate. In children below 11, it's 100%. So my son is neither aggressive nor hyper. He will be 7 years after 3 months and no meaningful speech, just 3 words: Pa, Mama, Papa, Mama, Nana. Therapy is being done. So he will improve Anand in speech because you have to understand that he will not get back speech no matter how much speech therapy you do. He will not get speech because his speech area is damaged. Once we repair the speech area with stem cells, his speech, the same. So this is what our therapists tell us. That they were struggling. I mean, therapists outside who have been treating kids before stem cell therapy, they really have to struggle. And then after stem cell therapy, with the same therapy, they get much better results because now they are working on a restored brain, a repaired brain, a regenerated brain. So the same therapy works much better. So I can't see any. 1 minute, I can see some. Somehow on my screen, I'm seeing half the question. So Rahul Singh, the question here is how much the severity of back pain in children after treatment? It's very little. So like 10% of the kids will have a little back problem. It lasts just for 2 or 3 days. By the time they go home, there is no back problem. That question was asked by Rahul Singh. So don't worry about the back pain at all. If at all it is there, it lasts for 2-3 days. By the time you go home, there is no back pain whatsoever. Then I hope I've not missed any. I'm trying to answer every question that I can. Vidya Kak says, my 5-year-old is ASD and plan to come to NeuroGen next month. Will the SCP help with tippy-toe walking and laryngomalacia? Oh yes, so tippy-toe walking improves a lot. I mean, almost all our parents tell us that this tippy-toe walking improves, they start walking properly. So that improves very well, that I can assure you. Your laryngomalacia, of course, we'll have to evaluate. Once you come here, we will evaluate the extent of laryngomalacia. It does tend to show improvement, in the majority of cases, but it will depend on the extent. So tippy-toe walking will improve, laryngo will improve completely. Tippy-toe walking goes away. But laryngomalacia will depend on the amount of damage. If it's mild to moderate, it should respond very well. If it's very severe, then sometimes we don't get the same results. And then what is the recovery rate? I missed something. Question. Okay, Anand, I got your question. Rahul Singh, severity of back pain, Shailaja, how long? Shailaja Bhardwaj says, how long we have to stay for rehab after the first SCP treatment? So we have a 1-week program. It is from Sunday to Saturday. So you come in on Sunday, Monday we do the evaluation, Tuesday we do the stem cell, and from Wednesday to Saturday, you have 4 days of rehab, 4 days. And but if you take the extended stay, there is a 15-day stay, then you have 10 days of rehab. So either you have 4 days rehab or you have 10 days rehab, depending on what option you take. Vidya Kak, my 5-year-old, okay, that is done. I think if a few people's question I've missed out, I'm really sorry because I'm not able to read everything. So Rahul Singh says, sir, my baby is 3 years old. He has only speech problem. Which age is good for treatment? Should I wait for? I can't read the whole message. Can you give me the whole message? Bora Rani says, sir, how many HBOT sessions ozone therapy do you recommend, and within how many months, years the session should be given? So we believe 20 sessions is the best. Okay, if you can give 20 sessions, that is the best. But 10 sessions minimum, when combined with stem cells, it works really good. So the minimum is 10, and ideally, if you do 20, that would be really good. And then this can be repeated. It can be repeated later. Which one? My goodness, I can't see the question there. My baby is 3 years old. He only had speech problem. Which age is good for the treatment? So Rahul, if your baby is 3 years old, this is a good time to do it because, like I showed from my data, the younger the child, the better the results. So if you do it now, you are going to have a much better chance at improvements. If you do it later, the chances of improvements become correspondingly lesser because the brain damage is, increases. And this is what our own research has showed us. So Rahul, my suggestion is, if your child is 3, let's do it at 3. Yeah. Shailaja Bhardwaj, what is? Shailaja says, what is the total cost of the treatment for a week? Shailaja, normally in a medical webinar, as a doctor, I don't discuss the cost. What you can do is you can email our hospital or you can WhatsApp and the staff in the hospital, because the cost depends on multiple factors and depends on the type of accommodation you take, and the different classes of accommodation, so on and so forth. So and I don't normally discuss the cost on a webinar, but if you email us, you'll get a complete written reply. You'll get all the options, which type of accommodation, how much it costs, all of that. Madhu Tandon says, hello sir, we are coming over for 1 month for my twin SCT. I want to know when my other twin is verbal, pretty close to normal and studying well. Only a few concerns are socializing with kids and a little hyper. Would you say SCT for him also? So Madhu, what you're telling me is that you are coming next month for one of your twins for stem cells, and you want to know the other twin who has milder problems. Should we do it? See, the decision to do it or not do it is based on the PET CT scan. So if we do a PET CT scan And if there is no damage, or there's very little damage, that, and I know you, even not being a doctor, can understand whatever's blue on the scan is damaged or working less. So suppose there's no blue or very little blue, then we would not recommend stem cells. But if the blue is more, it is significant, then we would suggest that you do both together. Okay. So I would suggest bring your twin over. Let's do the PET-CT scan, and let's base our decision on objective, not subjective. Because when you're saying verbal is close to normal, he's studying well, that's a little subjective. The PET scan is an investigation which tells us facts as they are. So we would suggest SCT for him only if his PET scan shows a problem. Madhuri asks, 15 days stay, how many HBOT will be done? For 15 days stay, Madhuri, 10 HBOT is done. What is the cost? I told you. Sarah says, thank you so much. Yes, sir, we have a... Anand Khalid says, can we have a session someday with success stories, parents and kids who are healed? Yeah, that's a good idea, Anand. I like that. Maybe we can have a session with some parents and kids. Maybe I think that's a good idea. We will request some parents if they're willing to talk. But what we do is we understand that as parents you need to hear. So when you come to us, we ask you whether you're willing to share. I mean, when parents come back to us after 6 months and they've improved a lot, or we ask them, would you like to share? And those who like to share, we do a video record of their testimonial, and it's put up on our YouTube channel, and we have thousands of testimonials. So that way we are not disturbing the parents, and you get to hear and see a testimonial as well. Rahul says, thank you, sir. Thank you a lot. Thank you. Okay, Anand. Manjula says, will SCT reduce spasticity in CP kids? Yes, Manjula. Spasticity significantly improves. After SCT, there is a dramatic improvement. The first thing to improve is actually the spasticity. And that happens very often within. Like the child is in the hospital, and you can actually see the improvement in spasticity. All right. I don't know if there. Archana says, thank you, sir. Thank you so much, Archana. Please pass on our love to Varuni. Vidya, what would be the volume of stem cells taken and injected back into the child? Is there any specific count of cells needed for the treatment? So Vidya, it's the volume taken is not the volume of stem cells, it's the volume of bone marrow. And all this depends on the weight and age of the child. And what is injected back also is a calculation which is based, everything is based on the weight and the age of the child. The volume is not important, the number of cells are important. So we are focused on the number of cells. The volume is small, just an ml, 2 ml or so. Manjula says, thank you. Thank you, Manjula. Priyanka says, how many months after second SCT can we come for third shot? So the minimum of 3 months. Priyanka, you need to have a 3-month gap. So you can come for between any 2 shots of stem cells, there needs to be a 3-month gap. All right, I hope I've not missed any messages. I'm trying to cover as much as I can. I may have missed a few because on my screen, I'm seeing only half messages. So I don't know what the problem is. Why am I seeing half messages? Okay, I'm told by the coordinator that everything is done. So thank you all. That was very interesting. Lots of questions. I really enjoy answering the questions. I'm very happy to answer any questions. And here's what I'd suggest to all the parents. Afreen says, thank you. Thank you so much, Afreen. You have to ask yourself one fundamental question. If after all the treatments you've already done, the rehab, whatever, biomedical, if there are significant improvements in the child, and if you think our child is going to get to be normal, then maybe there is no need for stem cells or anything else. But if in the heart of hearts you know that the improvements are not as much as you expect, then stem cells is a simple, It's a very simple, because it's only 2 needle pricks and the child's own cells, a very safe and a very effective treatment option that fixes the problem at the fundamental level. It goes to the brain and repairs the brain damage, right? We have the world's largest experience, and once you come to us, and the parents who run SCT will tell you that this our place is not like a hospital, it's like a home. You'll feel like you're at home. You'll be looked after. And we assure you that the best possible treatment available for these children anywhere in the world, we will offer to our children. So thank you for attending. It's very late, 7 o'clock in India. Thank you. And I would... Vidya says, can't wait to meet you next person, hopefully. Madhu says, thank you, sir. Bora asks, sir, if you are able to get the next SC within 3 months, will it be less effective? No, it's not like that. Of course, the earlier you do it, the better it is. So it's not that it will be less effective. The earlier you do it, the better it is. Bora, and thank you. Aparna says, thank you so much. Thank you to everyone. Afsana says, will SCT solve auditory issues? So yeah, if the auditory problems are because of damage in the brain, then it definitely improves. We've seen in a lot of our kids, the hearing improves. But if the problem is due to the nerve damage, then the nerve damage doesn't. So you understand, hearing, there is a hearing nerve, and then the nerve goes to the brain, and the brain interprets the sound. So if the auditory issue is because of a brain problem, it will definitely improve. If it is because of a problem in the ear, then it will not improve. Divya asks, can parents donate stem cells to the child? No, dear Divya, we cannot donate parents, because the child may not accept your stem cells. So we have to take stem cells from the child itself. All right. Okay, we are done. I think the coordinator tells me we are done. So thank you once again for a really, really nice discussion. It's something I really enjoyed. And I look forward to seeing many of you at NeuroGen in Mumbai soon. All right, Anand has one more question. So one more thing, will the SCT recover all the neurological issues, or you will only catch the affected area after consulting parents? No, SCT will recover all. It will basically repair the brain, Anand. It will repair the brain damage. And once the brain damage is repaired, all the problems, neurological, social, hearing, speech, cognition, everything will get repaired. So there is nothing like the stem cells catching only the affected areas. The stem cells will repair whatever is damaged in the brain, and then we expect to see improvements. All right. Give you a couple of, if there are any more questions, please feel free to ask. Otherwise, we will be closing the meeting. If you have any more questions, feel free to email them to us. You can WhatsApp us. You can go to our website and send us information, and we'd be happy to take care of it. So once again, thank you for all your attention. You all are very nice participation, and thank you. Anand thanks us for a wonderful motivational webinar. And all right, so thank you very much, and goodbye and good night. Take care.